meantime, CDC Director Robert Redfield saying that he's starting to see the tide turn against new coronavirus cases in the South. The CDC director specifically attributing this to mask wearing as well as social distancing. Let's bring in Suzanne Judge. She is epidemiologist at the University of Alabama at Birmingham School of Public Health. Doctor, you've got a pretty good pulse on what's been happening there in the South. You heard what the CDC director said. What are you seeing on the ground?
Absolutely. That's true. We're seeing more and more people wear masks all over the place, even in restaurants and bars, except when they're eating and drinking. At least here in the Birmingham area in the South, we're seeing lots more mask wearing, and our numbers have plummeted as a result. They're nearly half of what they were 4 weeks ago, which is really exciting as we're starting school. Most places in Alabama are either starting school this week or started last week, with the universities starting this week and next week. So it was important to get those numbers down before the kids went back to school.
What we've seen with a lot of universities, even those that decided to have some classes in person, they've quickly had to close down as a result of an uptick in cases, whether that's the result of a fraternity party or some kind of other event on campus. I mean, we all know how difficult it is to keep college students apart, but how significant a risk does that present to you? As you point out, you finally got the numbers under control. Now you've got this big risk staring at you right there with students returning.
Absolutely. It's the thing that we're all worried about in universities. We're watching the students very carefully. Here in Birmingham, we're working with our local partners at bars and restaurants to try to help them not engage in behaviors that might be really risky, like throwing back to school parties. We're trying to limit those types of activities. But it's like you've seen across the nation at the University of North Carolina, at Notre Dame. Just one event can trigger 10 to 15 cases. So we're keeping our finger on the pulse of it. We've got lots of systems in place to talk to students and to interview them if they do get sick, to figure out who they've come in contact with. But it's something we're watching very closely.
How do you enforce that, though? Isn't it just easier to keep classes online? Because we've seen from other universities that it's just really difficult for college students to keep that social distancing in place. I mean, what is the case to move forward with these reopenings?
The case to move forward is that some students don't learn well online. And in particular, this impacts disadvantaged students more. If they don't have access to high-speed internet at home or reliable computers and devices, it puts them at an unfair disadvantage when they're attending college. And the goal is to make this as fair as possible to get an education to everybody. But you're right, bringing them to campus does pose a risk. So we're trying a couple of things here in Alabama. We've tested every single student already before they've gotten to campus. We're continuing to test them every 2 or 3 days, hoping that we can be successful the way the NBA was successful with regular testing.
Yeah, and we have seen that success, especially with the bubble, with no new cases there. Let's talk about what Anjali was mentioning, the vaccine race here. We've got Pfizer and BioNTech now saying that they could be ready for regulatory approval by October. Is there more reason for optimism in the developments that we've gotten over the last few weeks? I know last time we spoke, we were talking about where things stood with the vaccine race. Has anything changed on the timing of all of this or the availability of it, given the headlines we've gotten from some of these companies?
No, unfortunately not yet. They're exciting and they mean we're still on the same path we were on the last time we spoke, but it hasn't changed the timeline. We're still looking at later or early 2021 before we would have anything that could go to the market and make a difference in the cases we're seeing.
And we're also getting this headline from Health and Human Services saying they will not, or COVID-19 hospital data will not be going back to the CDC here. There's a bit of back and forth going on right now. Can you help us clarify that?
Yeah, absolutely. CDC has been tracking hospital data for a variety of infections for quite a while, years. And Health and Human Services started pulling that data in with an external contractor. It was surprising to everyone in the academic and the governmental public health field. We thought it was going back to CDC. I'm surprised to hear it's not going back to CDC now. Initially, it led to a small complication in tracking hospitalizations, but at least here in Alabama, even with the data going to Health and Human Services, we've been able to get a good handle on how many hospitalizations we have in the state. So even though there is some back and forth, we're still able to track the data.
Yeah, how important is it to have that link, though?
Oh, it's critical. It's critical. It's one of the most important factors we're checking. It helps us know if the virus is getting more dangerous because more people are being hospitalized, helps us know if our hospitals are at capacity. It's an incredibly important factor.
And Suzanne, I feel like we always ask you this every time you come on, but it does seem like every time things come under control, there's a new risk that pops up. As you look to the fall season, particularly the flu season, what's your biggest concern in terms of challenges in getting this virus under control?
Having people sick with the flu and with COVID at the same time will be very hard for the hospitals. They already will be a little close to capacity with COVID, and then influenza will come in. So the November, December, January, those are going to be months that are critical for public health, for us to be reporting data rapidly. So we know what the availability of beds are. So we know if there are outbreaks going on in young populations like the university setting. These are a very important few months for us.
Dr. Suzanne Judd, epidemiologist at the University of Alabama at Birmingham School of Public Health. Always good to talk to you.
Good to talk to you, Akiko.